I'm Nurse Amina. I'm going to be your nurse today. How are you doing?
I'm feeling okay.
Before we get started, can you give me your full name and date of birth?
Homer Zhang, 9/18/1939.
Perfect. Okay. I'm going to wash my hands and get on some gloves. So today, we're going to be doing a tube feeding. Before I do that, I want to go ahead and assess your abdomen and make sure everything's looking okay. And then we'll go ahead and get you fed. How does that sound?
That sounds great.
Good. Okay, so can you tell me when your last bowel movement was?
It was today.
How did it look?
It was normal, brown, formed.
Good, okay. Did it smell weird or anything? Or just like your normal smell?
Just normal smell. It didn't smell too bad.
Good. Okay. So first off, I'm going to verify your orders, and then after I verify the orders, we can go ahead and get the assessment started.
Thank you for letting me know.
No problem. Okay, so orders look good. I'm going to go ahead and assess. Do you mind if I pull back the zone?
Go right ahead.
Okay, I'll give you a little bit of privacy first, and we're going to go and take a look. Okay, so first off, everything looks even and symmetrical. I'm not seeing any bulges, I'm not seeing any masses or anything like that. Your skin color looks good, and there's no redness, there's no skin breakdown, no signs of infection or anything like that, no dryness. So next up, since everything looks okay, I'm just gonna have a listen.
That's fine with me.
So, listen for the bowel sounds. Good. 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 Everything sounds good to me. Have you had any nausea or vomiting or anything like that today?
No nausea, no vomiting. Thank
Good.
goodness.
Good. Okay. Glad to hear it. So the last thing I'm going to do for the assessment is just palpate. You might feel a little bit of pressure, but let me know if you feel any tenderness or pain anywhere, okay?
Okay.
I'm going to go ahead and palpate a little bit. How does that feel?
Okay.
Okay,
Like you said, just pressure, no pain or anything.
Good, no pain. That's what we want to hear. Okay, since everything's looking good, I'm going to go ahead and get started with the tube feeding. So first I'm going to lift up your head of bed. So this helps to prevent any nausea, any backflow, anything like that. So to make the tube feeding go a little bit smoother, we're just going to put you in a position that's similar to how you would sit whenever you're feeding.
Okay.
That looks good. Next up, I'm going to check some residual. So I'm going to pinch this. Oh, this should be clamped. I'm going to pinch this, open it up, and go ahead and pull back. Okay, so there's less than 400 milliliters of residual, which means they can go ahead and give you your feeding according to the order from the doctor. The gastric contents look like a normal color, they're green, and everything looks good. So I think the placement is correct, and you don't have too much left over in your tummy. So I'm going to go ahead and give that back. And then next up, I'm going to flush this before I give you the feeding. So we're going to go ahead and give 30 milliliters of water and let gravity do its job. Slowly go down. Awesome. And according to the order, you're getting 30 milliliters of this tube feeding. So I'm going to go ahead and administer that. How are you feeling?
Okay.
Good. 30 milliliters. And then one last time, I'm going to go ahead and flush with another 30 milliliters of water. Let that go down. Good.
So, I know you've asked me a couple times if I was nauseous or felt like vomiting. Why do you keep asking me that?
Yeah, so it's really important to make sure that we try to prevent any nausea. So what I try to do is catch it as early as possible. That's why I keep asking you about it. And another thing that I do to prevent the nausea is to keep the head of your bed up, to make sure that we're giving the feedings a little bit slower, If you were to start feeling nauseous, I would keep the head of the bed raised. I would contact your doctor, see if I need to stop the feeding. Actually, I would stop the feeding, contact your doctor, see if we can slow the rate, see if maybe a different feeding formula would be better for you. I would also keep some suction tubing near the bed just in case anything happened, and just in case you aspirated or anything like that. But it seems like you tolerated it well. So yeah.
I don't think I have any other questions.
Okay.
I don't think I need anything else too, so thank you so much.
No problem. I'll lower you back down.
Awesome.